Welcome back. Joining us now is Africa 54 health correspondent Linord Moudou with news on how one West African nation is preparing just in case Ebola strikes within its borders.
The World Health Organization has marked Ivory Coast and Mali as countries with the highest risk of spillover from the West Africa Ebola outbreak. Efforts are being stepped up in Côte d'Ivoire to prevent the virus from crossing over. Ivory Coast, Tonpi region, shares a border with Liberia, where Ebola is widespread. In the region's capital, Mans, social worker Kone Disso and his colleagues go door to door to educate population on Ebola prevention measures.
We are in a high-risk zone because if we don't get the word out for prevention, we are going to see cases in Côte d'Ivoire.
For months, Ebola awareness campaigns have been airing on radio and television, along with pop songs on signs, symptoms, and how to avoid transmission. For Mama Doumbia, it's hard to accept the idea of being unable to help someone who is sick.
Since I was born, I've never even heard of this disease. What is this disease that keeps us from touching our sick?
For every illness, there are measures to take to prevent it. But with Ebola, it's much more difficult because it touches their culture.
Mans General Hospital has set up a treatment center with the help of UNICEF that could accommodate 4 cases in isolation if the disease were to spread. The hospital has assembled an Ebola response team and is responding daily to calls about suspected cases of the virus. Dr. Triba Joel is a pharmacist and heads the Ebola response team.
We can accommodate 4 patients, that is if eventually there are any cases. And it's well enclosed because each case must be treated in isolation.
Kone remains hopeful.
When I look at my own family, I tell myself that this is my motivation, to do everything so that the virus doesn't come to my country.
Kone, along with most people in Côte d'Ivoire, are hoping the disease will remain at bay. Training and capacity building is critical to ensure that those who come in contact with people who are infected with Ebola know the proper steps to prevent the disease from spreading further. Joining us now on the phone from Monrovia, Liberia, is Marion Subah, Liberia Country Representative for Jhpiego, an affiliate of Johns Hopkins University. Mrs. Subah, welcome to the program.
Thank you.
Thank you so much for joining us. Now, you work in a setting where, of course, there is this outbreak, and you provide training to health workers in a general hospital setting. Can you tell us what are the first steps that you recommend to healthcare workers when a patient walks in the door?
Okay, right now, due to the outbreak, we are recommending that they use personal protective equipment, which is called the PPE. Jhpiego worked along with the Infection Prevention and Control Task Force, which is headed by RBHS, which is another NGO led by JSI. But in it, we have the basic PPE for just triage. We are advising every health facility they must have a triage area. That is where you can access patients to temperature. So that person who they meet first must have like basic PPE. And if you are taking care of an Ebola patient, you need to have the enhanced PPE. That means that you need to be fully protected, that you do not touch anybody unprotected.
So we've seen that Mr. Duncan, who passed away here in the United States, is said to have been infected by a pregnant woman. So in a setting, in the maternity ward, for example, a pregnant woman that walks in the door, is she considered to be potentially an Ebola case, or do you address her as a pregnant woman first and then diagnose her if she has Ebola?
Like I said earlier, is first try to find out what, if she comes to the door, we want to do temperature, we want to get some questions on especially things related to Ebola, like Ebola symptoms. And then she can go to pregnancy if she's fine, no Ebola symptoms. or she can go to a triage area, to a holding area where she can be taken to get a test done if she's having Ebola symptoms. Where she can get a test, and she'll be able to confirm whether she has Ebola or not.
So,
pregnant people, it's a serious issue with pregnant people and Ebola.
given the present situation, what do you see as critical in order to protect the healthcare workers who are providing services, not in an isolation unit, but in a general healthcare setting?
Right now, we are working with the Ministry of Health in trying to CTUs, the Ebola treatment units. We are working with the Ministry of Health to restore maternal neonatal child health services. You may be aware Jhpiego is like a global leader in maternal neonatal child health. And so we have been working to do those services and get them working. For maternal neonatal child health, we always tell people that it's unlike other diseases. If a woman is pregnant, she has to deliver, she has to have the baby, and she needs a place that she can deliver safely. So we encourage the health workers to provide what we call safe care. And here in Liberia, the slogan for the training that has been adapted is called Keep Safe, Keep Service. And so we encourage the health workers to protect themselves and also to make sure the patient don't get any other infection.
Okay, Mrs. Marion Subah, thank you so much for joining us today. And that was Marion Subah, Liberia Country Representative for Jhpiego, joining us on the phone from Liberia.